I'm over 18 and I consent to this video.
Can I come in?
Yep.
Hello, I'm Amber. I'm going to be your nurse today. I just need to check your cranial nerve function, so this will be a quick test. And it'll just be asking you some questions to do some things, okay? Can you state your name and date of birth?
Tyler Bentley, 0617 and 91.
Great. So I'm first going to check the first cranial nerve, which is olfactory, which is smell. So can you smell the flowers?
Mm-hmm.
Okay. So cranial nerve 1 is intact. So now I'm going to check cranial nerve 2, which would be, actually that one would be the visual acuity test. So I would use the Snellen chart and I would hold it up away from you and have you read me line by line, covering one eye, then covering the other, and then doing it without covering either, and see if you can read it. So it would be visual acuity 20 of 20. Number 3 would be ocular motor, which is going to be checking 3, 4, and 6. So first I'm going to check Perla. So I'm going to have you just look straight ahead at me at my nose. Oops. Good. Good. And then I'm just going to have you follow this without moving your head. Good. So 3, 4, and 6 are intact. So now we're going to do cranial nerve 5, which is trigeminal. Can you feel me touching your face?
Mm-hmm.
On both sides?
Yep.
Good. So cranial nerve 5 is intact. Now I'm going to do cranial nerve 7. So I'm going to have you smile and frown, puff your cheeks out. Good. And it's symmetrical on both sides. So cranial nerve 7 is intact. So we're going to do cranial nerve 8, which is acoustic. So I'm going to have you cover this ear. And I'm going to whisper something, and I want you to tell me if you can hear it. Pancake.
Mm-hmm.
Tell me what you heard.
Pancake.
Good. And now the other side.
Bacon.
Good. So cranial nerve 8 is intact. So now we're going to do cranial nerve 9, which is glossopharyngeal. So you're able to taste okay?
Mm-hmm.
Okay, good. Can you swallow? Good. And
No.
you have no difficulty swallowing?
No.
And your gag reflex is present. Okay, good. So cranial nerve 9 is intact. So now we're going to do vagus, which is cranial nerve 10. His speech is clear. He's able to swallow. I'm going to have you swallow one more time for me. And I can feel his trachea and pharynx moving. There's a rise and fall of the uvula. So now we're going to do cranial nerve 11, which is spinal accessory. So can I just have you shrug your shoulders up and down? Good. So cranial nerve 11 is intact. Now we're going to do cranial nerve 12, which is hypoglossal. So can you stick out your tongue, wiggle it around? Good. And swallow again. Good. So cranial nerve 12 is intact as well, and his speech is clear and articulate. We're done.